Several years ago, our guest, Dr. Mike Milinkovic, suffered from severe migraines and sought the help of a chiropractor. He was so impressed with the results, there was no need for drugs or surgery, that he pursued chiropractic medicine as a career. Dr. Milinkovic now practices at GEO Chiropractic Clinic in San Marino. And he's here to explain what you can expect from your next chiropractic treatment. Welcome, Dr. Milinkovic.
Thank you, Heidi. Thank you, Larry, for having me.
You know, this is a great topic because there's a lot of confusion about what is a chiropractor. What is chiropractic exactly?
Chiropractic is a natural approach to healthcare without the use of drugs or surgery. Chiropractors are doctors, they're primary healthcare practitioners according to the Institute of Medicine, which gives them the ability to diagnose. And chiropractors are mainly concerned with disorders of the neuromusculoskeletal system and these effects that they can have on disease. Chiropractic is not a treatment, rather chiropractic is a profession. And a lot of times you'll hear chiropractic as referred to as an alternative healthcare system. And actually chiropractic is complementary, and it complements medicine in that it takes an aspect of certain neuromusculoskeletal problems and conditions related to the spine that medicine doesn't address.
So when somebody comes to see you, they will go through a series of hands-on manipulation, but before you do that, you want to make a diagnosis, of course.
Absolutely.
And making your diagnosis, is that, do you use x-rays, or what is it?
Chiropractors will go through an evaluation very similar to a patient who would go see a medical doctor. They would have a thorough consultation, a thorough examination. And what we look at is to see if a patient is a chiropractic case. There's certain standards that we look for. Okay. These days, evidence-based medicine seems to be the prevailing factor, and so we take that into account. A lot of practitioners are practicing that way. We do a very thorough neurological exam, orthopedic assessment, as well as a chiropractic palpation assessment. This is something you wouldn't get at a general practitioner's office. But basically it's to look to see how the spine is functioning and to see if there's any dysfunctions within the segments of the spine. Once that's established, if all things are, if the main things are ruled out, we may take an x-ray or send out for an MRI or CT scan if something more serious is happening. In the cases that chiropractors can recognize are not for a chiropractic, we would refer to a general practitioner or an orthopedic surgeon or neurologist in that case.
Are any of the spinal disorders that you see gender specific?
And some spinal conditions are. See, for the most part, chiropractors will evaluate patients not for very specific reasons. So, for instance, if you were to come in for an evaluation, going through a consultation, we would look at things like your health history. Have you been in any accidents, falls, injuries? Do you have any pain or symptoms? See, in my practice, majority of the patients that we treat are health and wellness patients. They're patients that come to us that don't have any pain or symptoms at all.
Is that right? They're asymptomatic people.
They're asymptomatic.
Oh, I see.
That is now becoming more prevalent because just like in dentistry, where oral hygiene about 50 years ago wasn't even heard of, you went to a dentist to either extract a tooth or to fill it in. These days you go to a dentist to maintain your oral hygiene. And the same thing now is becoming prevalent in spinal hygiene, and that's becoming a word that's being used more and more common nowadays. Yeah. And spinal hygiene is important because the studies show that if our spines are not functioning, see, it's all about function, and if the spines are not functioning properly, there's a chance that they will degenerate more. There's a study that was done about 4 years ago on an animal model, and they took 3 areas of the spine and they fused them. And I brought this here model because it sort of simulates an area of the spine that's fixated. It's not moving properly. It's dysfunctional. So what these researchers did was they took this area and they fused it, and they wanted to see what would happen after some time. What they noticed was quite amazing. Within 8 weeks, they noticed that this area of the spine started to develop degenerative changes. Now, once they took that fixation off, what they noticed was that there were some irreversible effects. This is a significant study because it sort of outlines the importance of having a properly functioning spine.
So somebody's going to come to you and they feel fine, and you're going to see what, they have a little curvature to their spine, or their posture is off, or
yeah, we would first start with a postural screen to see, and most people will have either one shoulder lower or one shoulder higher, or one hip or one leg a little bit shorter, and we look to see if it's functional leg length problem, meaning is it a function of the pelvis or is it a function of the low back or other areas of the spine.
In addition to seeing you, what are some of the suggestions that you make to your patients for improved spinal health?
Well, a lot of chiropractors practice nutrition. A lot of chiropractors do active and passive modalities such as stretching or strengthening. In my practice, we tend to focus on spinal manipulation. If there is such a need for strengthening the spine, we would refer them to a physical therapist, because that's what they do most of the time, is the active approach to dealing with the spine.
So you would do manipulation at times even if there's no pain associated with it?
Absolutely, because if we detect using palpation, it's a method that we use to detect spinal dysfunctions, or one of the methods, we would then, there's a basis for treatment in that case. And it used to be called subluxation, and way back we used to think that a spine would be out of alignment, but these days it's all about function. The spine is dynamic, and we're moving creatures, so it's all about function, and restoring the function in the spinal segments is an important aspect. See, chiropractic is a very safe and effective treatment, and according to a lot of the guidelines out there, the American College of Physicians, the American Pain Society, and even the Council on Chiropractic Guidelines and Practice Parameters, which are nationally accepted guidelines, put chiropractic treatment for spinal-related problems such as back pain, neck pain, headache in the forefront. So this is you would go to see them first, because it is the most studied out of all the modalities: traction, acupuncture, all of the different systems that exist out there. Chiropractic spinal manipulation has been the most well-researched.
So if somebody comes to you for back pain or neck pain or even headaches, what is, I know this may not be a fair question, but what generally is your success rate in treating these in overall?
Well, if they are a chiropractic case, according to my tests and analyses, they have a 100% success rate.
I see.
If they don't, and sometimes you can guess, it's a practice, and you say, you take a patient through a course of care and you see that things are not quite going the way you want to, we have to do a little bit more exploring. So we'll send them out to an orthopedist, or we'll send them out for an MRI or a CT scan. A lot of the conditions that we treat when it comes to back dysfunction are mechanical, and we need a mechanical solution for these problems. Conventional medicine treats it with a chemical solution, so non-steroidal anti-inflammatories. A lot of the analgesics, muscle relaxers. These are usually the conventional medicine's first line of defense. However, it doesn't address the problem of these of back pain and neck pain. For instance, if we look at this model here, one of the most prolific spinal researchers, Nicholas Bogduk, stated that all back conditions come from two structures, either one of the two structures, and that's these materials in here between that are sandwiched in between the vertebrae, the bones, and they're called the discs, the intervertebral discs, as well as the joints in the back here, which allow for motion of the spine, which are called the facet joints. So these two tissues are usually, or in about 90% of the cases, are the culprits. So guess which tissues spinal manipulative therapy is directed and best directed towards? Those two structures. That's right.
So somebody has, you're saying, so somebody has back pain, neck pain, headaches. it's not unreasonable to see a chiropractor first.
Absolutely not. And you know, a lot of medical practitioners are starting to realize this.
Yeah.
They're looking at these guidelines that are set nationally, and they're starting to realize that chiropractors can take care of these. In fact, actually a lot of complicated cases where people have neck pain that travels down the arm into the fingers, radiculopathy we call that. A lot of these conditions, you know, a lot of conventional medicine, general practitioners, orthopedists, are afraid to send them to chiropractors. A recent study done in the Journal of Chiropractic Medicine took a look at a group of patients that responded very successfully with chiropractic spinal manipulation.
So it really has a really prominent role these days, and it's very well.
It is, and it's really
effective.
It's not, again, it's not very you know, unconventional. It's mainstream. That's what we like to look at it as.
Well, we've run out of time. That's fascinating, and the success rate with a proper selected patient is almost 100%.
Great.
Can't ask for more than that. Well, thanks so much for coming. It was very interesting.
Thank you so much for having me.